Nutrition Science, Introduction to Nutrition Through the Life Cycle. Throughout all of the seasons of life, food is a basic human need. That's just as true for a newborn infant filling her tiny tummy with breast milk as it is for her mother, whose body is performing the physiological feat of synthesizing milk for her baby. And it's equally true for her grandparents, who are preparing a meal to share with the new family once they come home from the hospital. Food nourishes our bodies in every stage of life, but eating together is also a way of nurturing our social and emotional connections with one another. Yet, as we grow and change, so do our nutrient needs, and every stage of life brings unique challenges. We'll cover nutritional considerations in several key stages, including pregnancy and breastfeeding, infancy, toddlerhood, childhood, adolescence, and older adulthood. Nutrition in pregnancy and lactation. Becoming a parent is a huge commitment, and for all its many rewards, it's also costly to have a baby. And that cost comes not just in time and money. For mothers, having a baby also represents a nutritional and metabolic investment. Throughout pregnancy and infancy, a new human grows and develops, and this feat is made possible in large part because of the nutrients that the mother provides. Nutrient requirements are greater in pregnancy and lactation to provide maternal health, the healthy growth and development of the fetus, and the production of milk to nourish the infant. Physiology of Pregnancy. Human pregnancy lasts for approximately 40 weeks, and when counted from the first day of a woman's last menstrual period, and is roughly divided into thirds or trimesters. Dramatic changes occur throughout pregnancy, including in the earliest days, sometimes before women realize they're pregnant. Therefore, adequate nutrition is vital for women who are trying to conceive or may become pregnant. In addition, women who are either underweight or obese before becoming pregnant can find it more difficult to get pregnant and face greater risks of pregnancy complications. Therefore, it's recommended to establish healthy eating and exercise habits and work towards a healthy weight before pregnancy. Nutrition before conception is also important for fathers. Studies have shown that sperm quality is better in fathers who have a healthy body weight, consume adequate amounts of folate and omega-3 fatty acids, and follow a healthy dietary pattern, such as Mediterranean diet, emphasizing seafood, poultry, whole grains, legumes, and fruits and vegetables. Pregnancy begins when the sperm fertilizes the egg, and the single cell formed from this union begins to divide and differentiate. During the first few weeks of development, the cells of the uterine lining provide nutrients to the developing embryo. Between the 4th and 12th weeks, the developing placenta gradually takes over the role of feeding the embryo, which is called a fetus, beginning in the 9th week of pregnancy. The placenta forms from tissues derived from both the fetus and the mother, and this new organ becomes the interface between the two. The placenta provides nutrition and respiration, handles waste from the fetus, and produces hormones important to maintaining the pregnancy. The blood of the fetus and mother do not mix in the placenta, but they come close enough that nutrients, including glucose, amino acids, fatty acids, vitamins and minerals, and oxygen, can pass from the mother's blood to the fetus. And carbon dioxide and waste products can be passed from the fetus to the mother. In the placenta, the maternal and fetal bloodstreams do not mix, but nutrients, gases, and waste products can diffuse between them. The first trimester is a key period for the formation of embryonic and fetal organs. During the second and third trimesters, the fetus continues to grow and develop, with final development of organs such as the brain, lungs, and liver continuing in the last few weeks of pregnancy. Infants born before 37 weeks of pregnancy are considered preterm, and because they have not completed fetal development, are at increased risk for a range of health problems. Advances in neonatal care have greatly improved outcomes for these babies born too soon. But in most cases, the best scenario is for the fetus to have the full term of pregnancy to develop in the protective environment of the uterus, receiving nutrients through the placenta. Nutrients requirements during pregnancy. Pregnant women need more calories, macronutrients, and micronutrients than they did before pregnancy. However, the increase in nutrient requirements is relatively greater than the increase in caloric needs. Emphasizing the importance of a nutrient-dense diet. A dietary pattern focused on vegetables, fruits, whole grains, nuts, legumes, fish, and vegetable oils, and lower in red and processed meats, refined grains, and added sugars is associated with a reduced risk of pregnancy complications such as gestational diabetes and hypertension. There is nothing revolutionary about this dietary pattern. It's what is recommended for everyone. However, it's even more beneficial during pregnancy, as it promotes both maternal and fetal health. Energy intake and weight gain. During the first trimester, energy requirements are generally not increased, so women should consume about the same number of calories as they did before pregnancy. As fetal growth ramps up, energy requirements increase by about 340 calories per day in the second trimester and 450 calories per day in the third trimester. This is just an average. Individual energy requirements vary depending on factors such as activity level and body weight before pregnancy. Weight gain is a normal part of pregnancy. The growth of the fetus accounts for about 6 to 8 pounds of weight gain by the end of the pregnancy. Much of the rest comes from the development and expansion of tissues and fluids to support the pregnancy, including the placenta, uterus, breasts, amniotic fluid, blood, and maternal body fluids. In addition, women starting pregnancy at a normal weight should gain about 8 to 10 pounds of body fat and protein during pregnancy, in part to prepare for lactation. Weight gain comes not just from the baby, but from many different body systems changing to support the pregnancy. The Institute of Medicine recommends different amounts of weight gain in pregnancy depending on pre-pregnancy BMI, or body mass index. Women who were underweight before pregnancy need to gain more, and those who were overweight or obese before pregnancy need to gain less. Gaining too little weight in pregnancy can compromise fetal growth, leading to the baby being born too small, which can cause increased risk of illness, difficulty feeding, and developmental delays. Gaining too much weight in pregnancy can cause the baby to be too big at birth, leading to complications and increasing the risk of needing a cesarean section birth. it can also make it more difficult to lose weight after pregnancy. Nutrition Science. Introduction to Nutrition Through the Life Cycle. Throughout all of the seasons of life, food is a basic human need. That's just as true for a newborn infant filling her tiny tummy with breast milk as it is for her mother, whose body is performing the physiological feat of synthesizing milk for her baby. And it's equally true for her grandparents, who are preparing a meal to share with the new family once they come home from the hospital. Food nourishes our bodies in every stage of life, but eating together is also a way of nurturing our social and emotional connections with one another. Yet, as we grow and change, so do our nutrient needs, and every stage of life brings unique challenges. We'll cover nutritional considerations in several key stages, including